Thank you and welcome to the show this morning. The topic this morning has to do with the mental health system in the United States. And we're fortunate to have with us to talk about mental health in the United States of America, Dr. CPoe. Dr. Poe is certainly no stranger to my audience here this morning, and he will give us some additional information in reference to his background, education, and some other things, and then we'll talk about the mental health system in the United States, focusing up on Tucson. And of course, Dr. Poe, let me welcome you to the show again for the many, many times that we've had the privilege of having you here to enlighten us in a real sense about some of the things dealing with the mind and some of the things dealing with the spirit. And this, I think, is a very, very interesting topic because it deals with what apparently is a very, very important problem. And of course, we've addressed it before, dealing with the mental health system in America. So let's start off, Dr. Poe, by having you to simply give members of our audience who might not know you a little information as to your background, education, and et cetera. And then let's get started dealing with mental health in the United States.
Dr. Haney, I'm a minister, minister of the gospel. I'm also a psychiatrist, a clinical psychiatrist. I finished Tennessee State back in 1960, went to Mahara Medical College, did my internship in Chicago, did my residency in Berkeley, California, spent 2 years in the Army, came back to Nashville in 1976 and been here ever since. I have a private practice part-time in Dixon, Tennessee. I'm an assistant pastor of a church in Laverne, Tennessee, Christ Miracle Chapel. That's essentially my background.
Okay, very good. And Dr. Poe, you know, I think that we've talked about mental health in the United States, and we've talked about the violence that's generally associated with that. But I think that you've got a sort of an unusual take in terms of some of the events that have occurred in the United States, especially the most recent killings that occurred in Arizona. So let's talk about it from that perspective.
Right. I think it's important that we try to understand why this young man became violent and killed 6 people and wounded 13. My belief is that he probably was suffering from a significant mental disorder prior to the shooting. We do know that he dropped out of high school before his senior year and began to engage in alcohol abuse as well as other drug abuse, probably marijuana, and according to the information I've read, hallucinogens as well. So if he were mentally ill before, indulging in drugs intensified his dysfunction. We also know that he had a lot of difficulty relating to other people. He isolated himself. People spoke to him in the neighborhood. He refused to speak. He had a lot of difficulty holding down jobs. He lost 2 jobs in class at Pima Community College. He was disruptive. So the young man was hurting. We also know that he was delusional. He felt that the federal government was trying to control his mind. I understand also from the internet that he had a lot of hostility towards religion and that he's described as an atheist. So the man was very much impaired, or is very much impaired. And I think that led to the violence. Now, most people who have a mental illness don't commit these kind of crimes. Okay, let me just make that point very clear. But in his case, I think his situation was aggravated by the alcohol and the drug abuse.
Well, now, what do we do in terms of mental health in America, Dr. Poe, to keep this from happening? And what would you say would be the genesis or the origin of the kind of mental situations that we're finding today?
Well, I think that mental illness is probably the major public health problem that we have in the nation today. And I think that has a lot to do with the dysfunctional family life. As you know, many homes are broken, single-parent homes. Many families have a fair amount of domestic violence, marital separations. All of this contributes to the kind of atmosphere that damages a person's, the child and the adolescent's self-image, that damages their self-esteem, and often the children are being neglected, and all of that then contributes to personality problems. It contributes to attitudinal problems, behavior problems, and contributes to alcohol and drug experimentation. So you recall Dr. David Satcher when he was Surgeon General. He did a study of the mental health of the nation and came up with the fact that mental illness is a major issue and it needs to be addressed. So
let's stop for this first commercial break, as you know, and then we'll pick up and pick up at that point, and we'll be back with our audience following this very, very short commercial break. The